Hello, how are you? I'm Dr. Shariful Halim, and today I'm going to talk about how to take preparation for your eye and ENT part. I mean, the surgery second paper for final professional examinations. Somebody asked me to make a video on that, so thanks to him to give me the idea. So, about eye, you have to focus on the most common diseases. So, if you start with just the structures in the eye, suppose it's the lid. So in the lid, the most important things are stye and chalazion, and also blepharitis. And in the conjunctiva, the most important things are conjunctivitis. So all the conjunctivitis are very important: allergic, bacteria, and also viral. And in the and one thing is pterygium, which is actually an extension of the conjunctiva over the cornea. It's also very important. Maybe a case can be given in your prof. And in the cornea, the most important thing is the corneal ulcer, especially everything about corneal ulcer, especially the difference between bacterial and fungal corneal ulcer are very important. And also keratitis is a bit important, but not that much. And One thing that covers both conjunctiva and cornea is vitamin A deficiency. I mean the gerophthalmia. So gerophthalmia is a very important topic. And then in the anterior chamber or posterior chamber, you can consider the glaucoma. So primary open-angle glaucoma or acute congestive glaucoma, both are very important, especially definitions of glaucoma and the clinical features and management of acute congestive glaucoma are more important. And then the lens. So the most important thing is cataract. So study cataract very well. This can come as a case in your professional exams, so that's very important. And in the retina, the most important things are to cover is diabetic retinopathy, which can also be studied in medicine also. So it's very important to study the findings of diabetic retinopathy, especially on fundoscopy, and also know the difference between non-proliferative and proliferative diabetic retinopathy. Hypertensive retinopathy is very important. And another important thing in the retina is retinoblastoma. So I had some questions of retinoblastoma in my viva in the final prof. So I think that's also an important topic. And about the lacrimal drainage pathway, so dacryocystitis are still always they are very important. So acute dacryocystitis and chronic dacryocystitis are very important topics. And there are some general topics that can come, such as the anatomy of eye. So the anatomies that I consider more important are such as the lacrimal drainage pathway, and then the layers of the cornea, very important, and the questions regarding why cornea is transparent, the anatomical factors or physiological factors responsible for the transparency of cornea. I think that's very important. And the one very important thing is aqueous humor drainage pathway. It's very important, because if you don't know the drainage pathway, you cannot integrate this information into the presentation, and also you cannot integrate the information into the pharmacology of how to manage the glaucoma. So I think that's very important. So don't forget to remember that. And lens structure, you should identify the lens structures. What are the structures, or what are the basic components of a lens? The capsule and the cortex and the nucleus. And then the retina. So you have to study the different layers of retina. So it's a memorization. So the 10 layers of retina have been an important topic and are an important topic. And behind retina you have the optic nerve. So learn how the light is transmitted to your occipital area. So the area 17-18-4, what is the pathway, and also learn what is the light reflex pathway and what is the accommodation reflex pathway. Those are parts of physiology, but those are still asked in the question or viva. And please acquire some clinical skills, especially how to examine a patient's visual acuity. So please do learn that, and I will make a video later to show you how one should actually examine the patient and identify or assess his or her visual acuity. So I think that's a very important clinical skill to develop. And also optic nerve examination is also important. I think those are the most important things. And apart from these there are some accidents and emergencies which you should cover, such as the foreign body in the eye, or penetrating eye injury. What are the things that can be injured by a blow to your eye or eyeball? Okay, so those things are also need to be covered. And also you learn something about OSPE. I think the best book to learn OSPE from is the Samsujaman sir's Shamsul Hoxer's book. Actually, the topics that I already mentioned are very good, are well written in Shamsul Hoxer's book. And you can also take help from guides, especially to understand what actually comes in the board questions, and you can actually make notes from Shamsul Hoxer's book, and also you can take help from Boshak. But I think Shamsul Hoxer books is enough for most of the people, and there are auspices in the backside or in the last chapter of the Shamsul Hoxer's book, and I think that will help you. And also some procedures, so know the procedures of dacryocystoidectomy, how it's done. So this is because it's very important. You will be asked in the exam about it. So I think this is the basic things about to remember when studying eye. Okay, so when you study ENT, I think the best resources are first of all your lectures. So for DMC guys, I think the Muhyiddin sir's lecture are very good. So please take lecture notes or collect from your friends or collect from your seniors, and those are very important things. And also collect the card question. So there is a note which can be found at the Fadl Hall. You already know that there is a ENT note of card questions, which is actually annotated and corrected by us and our friends. So collect those, and they are very important because you will be asked those questions in the prof. So learn this note by heart. And also the topics that you should cover that I'm going through a little bit. So about nose, you have to know the DNS, the polyp very well. Those are very important things. And also sinusitis, acute and chronic sinusitis, and then also know some anatomy like the anatomy of the nasal septum. So how nasal septum is formed, what is the bony part, and what are the cartilaginous contributions, Kissel plexus, and something like that. And also know the locations of the sinuses. So where the maxillary sinus is located, where the ethmoidal sinus located, where the frontal sinus located, and where the sphenoidal sinus located. Those are important things to remember, and it will also help you in clinical practice. And then nasopharyngeal angiophragma is also an important topic, and someone say rhinosporidiosis is also a bit important, but not that much, but a bit important. Okay, so those are the important things in the nose. And in the ear, the most important things are ASM and CSM, so know them very well. And also OME, I mean otitis media with effusion, are also a bit important, and those are the things that are covered in the middle ear portion. In the external ear, I think the most important things are pharynculosis and foreign body in the ear. So those things are very important to know, and also important for your clinical practice. And in the inner ear, the labyrinthitis is a bit important, but not that much. So know the anatomy of the ear thoroughly, and very importantly, know the connection that if someone has some diseases of the upper respiratory tract, it can actually involve his or her ear. So if there is infection in the throat, this infection or this infection can spread to middle ear. So always consider that, and also study the anatomy of the eustachian tube and how it differs between a child and an adult. So that's very important. So in the throat, the most important things are tonsil. So know everything about tonsil, what is tonsillitis, acute and chronic tonsillitis management, and what are the indications of tonsillectomy, and actually anatomy of the tonsils. The very important questions. Okay, and the pharynx, you have to know about retropharyngeal abscesses and parapharyngeal abscesses, and especially acute and chronic retropharyngeal abscesses difference. I think those are the very important questions that you may be asked. And the larynx and other parts, the epiglottitis, laryngitis are very important, and the carcinoma of the larynx are also very important topic, and I think it's a very clinically important topic, and you have to know some anatomy of the larynx, and know a bit about tracheostomy because it's asked commonly. So what are the procedures of tracheostomy, what's emergency, and what's permanent tracheostomy, and what are the procedures, and what are the complications of tracheostomy that can develop, and how will you manage a patient with tracheostomy tube. So I think those are the very important questions that you need to remember. And if you want to know about the cases that you will be given in the profs, the cases are, most common cases are polyp, nasal polyp, DNS, or a case of tonsillitis, most commonly chronic tonsillitis, and a case of CSM, maybe aticantal variety or maybe tympanic variety. So those are the 4 or 5 cases that you will be given in the prof. So learn how to examine each part of the ear, nose, and throat. So learn how to hold a thuricum nasal speculum. Everybody knows that, but in the prof, it happens that it becomes a tough job to hold a 2D gum nasal speculum. So don't forget to practice for at least few times, maybe 3 or 4 times at least, to hold a 2D gum nasal speculum. If you can understand how to hold it, see some YouTube videos of 2D gum nasal speculum. So I think that will be helpful. And also know how to examine the ear, know how to assess the auditories. So how to assess a patient's ear, such as examination of the ear. So you pull the ear upwards, backwards, and laterally. So this is very important to expose the ear canal, and also know how to do a tuning fork test. So the Rene test, the Weber test, and the absolute bone conduction test, and also fistula tests are important to know, especially Rene and Weber. Please note that those are very important tests. Know everything about that. And one thing that I remember, I forgot to mention that one disease of middle ear is otosclerosis, and one disease of inner ear is Meniere's disease. Those diseases are also important. Okay, about the clinical examination skills, also you have to know about how to examine the lymph nodes of the cervical region. So those are not commonly given, but knowing it is good. And about the OSPE portion, you have to consult guides for that, because there is no such books demonstrating that bit of OSPE. And if you want to study a reference book, I think Dhingra is a very good resource to look on. I think this book contains a lot of things that you need to understand. And one thing that came in our prof is tympanogram and audiogram. So if you can search YouTube and learn about tympanogram and audiogram, and also consult the Dhingra book, and it has some good amount of information on those things. So I think that should cover up your basic preparation of ENT. And also I've already talked about eye. So if you have any questions regarding those topics, please don't feel shy to ask me, and please like my channel and subscribe and share these informations to your friends. And wish you good luck with the final professional examination.